Okay, so I want to ask about that. When you talk about liposuction or taking it from the midsection here, that's all great. But then what about the loose skin that comes with it? And then that brings me kind of into the question of everyone's doing Ozempic or something
Yeah.
similar, and people are losing weight at more of a rapid pace than we've ever seen. So I want
Right.
to talk to you about loose skin, what we're doing with areas that we might have less fat, but we have stuff. And you don't you need to fill that up to make it look taut?
Well, in certain areas of the body, you want to fill. So when I hear of, filling an area up so it looks a little tighter, I tend to think more on the face, right? We can do a lot more because in the face, what tends to happen is we tend to lose volume as we tend to get the skin elasticity, but we lose volume first. So
Mm,
it's really nice to fill the areas in your face because that helps prop everything up.
right.
However, for the body, you don't ever like if you're doing liposuction to the muffin tops, that's sort of a counterintuitive idea, right? You want to take away the fat, but you don't want to go back and fill it to make it look taut. You hope, and you can assess this by the skin, if there's not a lot of stretch marks, the skin has good quality, and the patient's young, let's say in their 30s, 40s, sometimes 50s, depending on how good the skin is. When you take away the fat, the skin is redraping around the underlying skeletal portion. But
Mm,
a good example would be a mom who stretched out the abdominal skin. That skin is really loose, right? And if you liposuction loose skin, it's just going to look looser.
right.
So in those areas, because you see stretch marks typically, you do want to address not only removing fat, but like a tummy tuck might really help you pull taut the skin, repair the muscles, because sometimes you have a stretchy abdominal wall. So you got to repair this muscle diastasis, as I call it.
Mhm.
And that's really going to help do that. So yes, you have to be mindful of areas that might become looser. I think another area that's sort of tricky is the arms. With
Mm.
all these people losing a lot of weight, we're seeing a lot of loose, saggy arms. And so I have to look at the arm and assess, is that skin good quality that I can just liposuction and expect the skin to sort of rise up and re-encapsulate the arm so it's not draping and loose? If I don't think so, then we have to start talking about non-invasive ways to tighten the skin through a med spa, whether it's ultrasound frequency, or the most aggressive, and we're doing more of, is like arm lifts. We actually have to make an incision on the inside of the arm to tighten it. Yes, it's a longer scar. Maybe it's not great, but I'll tell you, someone on Ozempic who's lost 100 pounds, who have what we call bat wings. You've heard of
Mhm.
that word?
Of course, yeah.
They don't care about the scars.
Yeah.
They want that skin off. So it makes sense for someone who's lost 100 pounds. But if you came to me and said, I don't like the little bit of loose skin on my arm, I would say, you know what? I'm not going to do an arm lift on you. It's not worth it. You're
Mhm.
better off doing more of maybe some ultrasound lasers to help tighten up that skin because you don't have any fat either. So there's nothing to liposuction. So you have to look at non-invasive ways to treat that.
Do those lasers really work, that those skin tightening lasers?
I think that they work modestly. And so what I tell people is because if they worked really good, I would be out of a job, right? Like
Right.
if they
Well,
could tighten it so much that there would not be a plastic surgeon on, a corner telling you I can do a tummy tuck or a butt lift and all these different things because they would all go to the med spa and the machines would have taken over what we do surgically by doing tummy tucks. So they do help to a small degree. I always quote people, listen, if you don't want this scar, but you want some skin tightening, then you're probably going to get 10 to 15% improvement. And I show them by tightening up their skin and showing what 10%, 15% might look like. If they don't feel like that's worth it and they'd rather go for a tummy tuck with a longer scar, then I say, let's do the tummy tuck because now I can tighten your skin as much as I want to and get you as flat as possible. So
right.
it's really just kind of tempering expectations. But I agree with you. And I've used all the lasers that are out there. Body Tight, Morpheus, Renuvion. These are things that are meant to go underneath the skin, on top of the skin, try to tighten the skin. And I'll tell you, no matter what they say, it's about 10 to 15% improvement. And if someone's lost 100 pounds, don't waste your money. You're not
Right.
going to tighten the skin up. You don't need 10 to 15%. It's a waste of money. You really need someone who can remove the skin. So it's usually those what we call in-betweeners, people who have always been in good shape their whole life. They're getting into their 50s and 60s, and it's like, I just have this loose skin, but I've always been in good shape. That's probably someone who might benefit from that because they just, you can't do a true tummy tuck. They don't have that much loose skin.
Right. Okay. Another thing I know people want me to ask you about is cellulite. What are the best treatments that really work and show results? Or can you even do anything for cellulite?
Yeah, cellulite's a very difficult one. And I'll tell you the reason why hopefully most people will intuitively know that there's not a good treatment is because every treatment that comes out goes out of business in about a year and a half.
Right.
So, you hear, and I'm sure you've heard of these things, and I forget some of the names because they come and go, but they tend to come on the market. They do this mass, media and branding, and you're thinking, oh, this is the new one. I'm trying to think of the one that was an
Well, there's
inject.
like M Sculpt or something
Right,
that's supposed to build muscle. There's something like a RF frequency with cavitation,
right.
if you know what
So
I'm talking about.
yes,
I've done all these, by the way.
so like you were saying, cellulite's difficult to treat. So some of these products that come on get a lot of branding. There was one that was where you could inject this basically liquid that would somehow lyse these adhesions that were pulling down, creating that dimpling or that sort of a pillow, pillow top appearance to it.
Yeah.
But what happened was, yes, it lysed it, but it created so much oozing and bleeding, people were starting to get staining of their skin. So that went away. And then you have, like you said, the cavitation that shakes it, try to kind of loosen things up, radio frequency to try to then tighten the overlying skin. There's needles that go underneath the skin that hook those little lice, those little adhesions, creating that sort of pin cushion appearance to release it. But when you look at the before and afters, from the companies, I think they look okay, but if you really look at them, they never are 100% improvement. And when you really look at them, probably another like 6 months to a year, they probably all tend to come back. And that's been my experience.
Yeah.
And so what I think is if you want to stay and do treatments with ultrasounds and the cavitation every 3 to 6 months, you can have a 10 to 15% improvement, but you have to keep up with it. And most people do not keep up with it. They want to
Right.
want.
Well, it gets expensive and, it's time consuming. I have noticed with the cavitation and the RF frequency or whatever it's called, that right after it does look good, but it's almost like getting a good massage. Like your skin
Sure.
just looks supple and,
Right.
moisture, like there, it's just a different texture, but like give it a day and it kind of goes back. So, I don't know. I think that will be exciting if someone ever comes up with a real treatment for
Yeah.
that.
But there is a
Go
way
ahead.
to treat that cellulite that sometimes you see in the bottom from a lot of weight loss. And we do have a picture, and maybe we'll share that afterwards. But when you do a body lift, when you actually do a butt lift, not the Brazilian butt lift where you inject fat, but a butt lift where you lift up the skin on the bottom. People who start developing cellulite from loose skin, from losing a lot of weight, when you do a butt lift and lift it, I
Mhm.
can make the cellulite all go away. And so I have plenty of pictures that show a reduction of that butt cellulite with pulling the skin nice and taut because it's the skin laxity that enhances the pin cushion appearance. But again, not everybody's getting a cellulite because of massive weight loss. It's usually moms who are in good shape or women who have never been out of shape and start to see it on their legs and lower part of their butt. So you're right. It's hard. There's not a great treatment. And when there is, you'll see everybody using it for years to come, but we're just not quite there yet.
Right.